Bismillahirrahmanirrahim. These are the few important questions regarding the mediastinum. Question number 1 is: a patient with a back injury has a fracture of a vertebrae that includes a heart-shaped body, costal facet, long downward sloping spinous process. Which type of vertebrae is it? It is thoracic vertebrae. What is the function of the costal facet? Articulation with the ribs. Question number 2 is on the identification of cervical vertebrae. That is, radiology shows a vertebrae with bifid spinous process and transverse foramina. Identify the type of the vertebrae. It is a cervical vertebrae. Which structure passes through the transverse foramen? Mainly the vertebral artery, except C7, mainly the vein. Saddleback cardiomegaly shadow. A 60-year-old man presents with the dysphagia due to the posterior mediastinal mass compressing a muscular tube. Which structure is involved? It is esophagus. Main arterial supply of its thoracic part, esophageal branches of the descending thoracic aorta. Question number 4 is: a 35-year-old male presents with thoracic trauma after a road traffic accident and is now in a hypovolumic shock. Imaging shows a significant hemorrhage collecting in the posterior mediastinum. Which major artery is most likely injured? Descending thoracic aorta. In which anatomical structure compartment is this artery located? It is present in the posterior mediastinum. List the boundaries of the posterior mediastinum. Anteriorly, pericardium is present. Posteriorly, bodies of T5 to T12 vertebrae. Superiorly, transverse thoracic plane, sternal angle T4 to T5. This inferiorly, diaphragm is present. Laterally, mediastinal pleura, lung surfaces are present. A patient presents with the facial swelling, engorged neck, and difficulty swallowing, difficulty breathing. CT scan shows a mediastinal tumor compressing a major venous structure in the superior mediastinum. Which structure is compressed? It is the superior vena cava. List 2 contents of the superior mediastinum. Behind these structures are aortic arch, trachea, esophagus, brachiocephalic veins, vagus, and the phrenic nerves. Okay, boundaries can be asked to you of the superior mediastinum. Superiorly, thoracic inlet aperture, which is formed by the first thoracic vertebrae. Posteriorly, first rib and superior border of the manubrium. Inferiorly, transverse thoracic plane, imaginary line from sternal angle of Lewis. And anteriorly, this is the anteriorly manubrium of sternum. Posteriorly, bodies of T1 to T4 vertebrae. Laterally, mediastinal pleura. This is a quick mnemonic for learning the superior mediastinum boundaries. Posteriorly, T1 to T4 and inferiorly, transverse thoracic plane inlet. Superiorly, inlet is present, and anteriorly, manubrium. A man has restricted upper rib mobility due to costovertebral joint arthritis. His anterior-posterior thoracic expansion is reduced. Which type of rib movement is affected? Pump handle movement is affected. Which ribs mainly perform this action? Ribs 2 to 6 perform this action. What dimension of the thoracic cavity increases normally by this movement? Anterior-posterior diameter. A 45-year-old asthmatic has reduced transverse chest expansion. Which movement is restricted? Buccal handle movement is restricted. Which ribs show this movement? Ribs 7 to 10. Question number 8 is: a surgeon palpates a costal groove while placing an intercostal chest drain. Which structure runs in the costal groove? Intercostal vein, artery, and nerve van. Superior to inferiorly, it is present. Why insert needle above the rib rather than the below? To avoid the injury to the van bundle. Penetrating injury at the root of the neck damages a rib with no neck or tubercle. Which rib is affected? First rib. The rib without neck or tubercle is 11th or 12th rib. This question can be asked to you in any way. Why are these ribs more prone to displacement? They are floating ribs with no anterior attachment. Thank you.